think before I answer that, I'll just say that I was originally diagnosed with early breast cancer in 2011, and I was hormone and HER2 positive. And then in 2016, my cancer returned. It had metastasized to my liver, and again, I was hormone positive and HER2 positive. So I'll be answering all the questions based on my current situation. So I first started noting symptoms in probably February or March 2016. I was getting extreme exhaustion, and I started to become really nauseous. And this went on for a couple of weeks. So I thought I might have just been low in iron. So, yeah. Because I was feeling like this, I went to see my GP, who ran some blood tests. And then she rang the next morning saying that my liver functions were off the scale and could I come and see her straight away. She said I needed a liver ultrasound, and she rang around and got me booked in. And then about 4 o'clock that afternoon, she rang me back and said, "I'm so sorry to do this over the phone, but you've got secondary breast cancer in your liver." I don't know how it had come back, but yeah. So then she sent me to my oncologist, who I'd had before, and she assumed it would be the same pathology and based a treatment plan based on my original pathology. And that would be chemo and then 2 targeted breast cancer drugs of Herceptin and Perjeta for the HER2 positive. And then I had a liver biopsy, which confirmed that it was HER2 positive again, so I could go ahead with that treatment plan. Well, I knew what HER2 positive was because I'd had it before, but the fact that I had metastatic breast cancer this time, that was all new, and I was in denial for quite a long time. I know that you can stay stable for quite a long time with current treatments, so that was good to know. It all depends on how well your body responds to treatments and how quickly the cancer can mutate and change. But having had Herceptin before for HER2 positive, I knew that's a bit of a wonder drug, and now combined with Perjeta, I thought that was a really good drug combination to be going on with. Well, at the moment, fortunately, I have no evidence of disease. I'm cancer-free. My last CT scan was clear. My last brain MRI were clear. So I'm just continuing with the Herceptin and Perjeta every 3 weeks. But we may need to revisit that soon because of the side effects that I'm having. Well, she based it on my original pathology, like I said, and then when it was confirmed that it was HER2 positive again, there was going to be chemo of Taxotere for about 4 months, and the Herceptin Perjeta ongoing every 3 weeks indefinitely. And if these didn't work or stopped working, then we would change to a different treatment plan, because it was a treatment plan, B, C, D. She seemed rather flippant that there was plenty of options available. Well, the fact that it was going to be the chemo, and she would have to have a reduced dosage to begin with because my liver was there were so many lesions they couldn't even count them. And the fact that having the Herceptin, I would have to have a echocardiogram to begin with, because it can cause damage to the heart. It's one of the major side effects. And that still goes on every 6 months. I get that done. And fortunately, my heart's still ticking along nicely. So the Herceptin doesn't really upset me. It's more the Perjeta that has the side effects. And we discuss those from time to time. Yeah. Well, the number one issue is that I can continue to work full time. Yeah, because I have done it the whole way through, because I'm the main income earner for our family. So it's very important that I keep working. And my employer is very happy. that I can take, for me to take time off when I need it. But I did find that having 1 day off every 3 weeks to have treatment was using up a lot of my leave. So I now just take a couple of hours off on one afternoon, and I'm only tired for a few hours instead of a whole day. So it actually, I've worked it out better, so that works better for me. But the side effects, they are starting to have a cumulative effect, and changing the way I do things, from the way I exercise. Yeah, it'd be nice to keep going as I was a couple of years ago when there were no issues. Yeah, because it's also really good for my mental health to be exercising. And when I've got neuropathy in my feet and my fingers, it makes things a lot more difficult. I do, when I have checkups, I do talk about things that are going on, but only just recently did I sit down with my oncologist and list out every single side effect so that she had a full rounded list of what was going on, so we can make informed decisions going forward based on that. Because before I was just telling her one thing here and one thing there, and she was very quick to just write out a prescription and not to look at the underlying cause. So I think we're getting more into discussion mode now. No one's ever mentioned any clinical trials to me, but I did find out myself about a trial for the Mona Lisa touch for managing menopausal symptoms in women. So I was involved in that. First of all, is it the best treatment for me to be on for my diagnosis? What are the side effects going to be? Will they limit my ability to do things like go to work or exercise? What happens if I don't take this treatment? For example, my cancer came back in my brain in 2018. So when I saw the neurosurgeon, I said, well, what if I don't have surgery? And he said, well, in a couple of months, you won't be able to do anything you normally do, and within a year, you probably won't be alive. So sometimes you don't get an option, it's just you have to do it. But it's good to be able to discuss the pros and cons of each treatment. I think it's definitely changed. I find that my husband's very much a researcher, and he's always done all the research and told me just to leave things go. But I now find that I'm making a lot more of the decisions regarding how things go, because I'm now researching, because I'm not dealing with side effects of chemo. It's just ongoing every day. I'm healthy. So yeah, I have a bit more input now, and think I'm learning so much more as I go along that I didn't know earlier about not just HER2 positive, but metastatic breast cancer. When I was originally diagnosed, I had a lumpectomy, and then I had 12 months of Herceptin, which was every 3 weeks. And then when it came back in 2016, I started the Herceptin and Perjeta together. That was just every 3 weeks, and I've done that for 6.5 years, which is 111 treatments. Also, because it spread to my brain, I had a craniotomy, and then I had radiation, 5 sessions of radiation on my brain. And then it came back again on my brain in 2020, so I had more radiation. Now I'm also, because of the side effects, I'm seeing a podiatrist, and I'm going to see an acupuncturist soon to try and deal with the neuropathy. I'm seeing an exercise physiologist, because I haven't been exercising. I've sort of lost a lot of my muscle tone, and I need to get back into exercise again. And I have had to see a psychologist when things got really bad in 2018. But that was the first time that I'd actually gone and seen one. So well, I need to keep seeing my blood results my cancer markers staying normal. I need to see no evidence of disease on my CT scan and my brain MRI. Well, my biggest fear is not being able to work. I mean, I still had plenty of, sick leave and annual leave and long service leave, but I don't want to become dependent on someone else. I want to keep being able to drive. I want to keep doing all the things I'm doing now. And so side effects too. Yeah, I don't want to end up with a new diagnosis that has spread, and now it's in my bones, and I'm in pain and having to give up my job or something like that. Anything that's visual, like showing me something on a graph or a flow chart, that's really good. My oncologist, when given me a new drug, he's given me a printout, which is only like 1 or 2 pages. It's really easy to read. Something really simple, not getting piles of handouts or flyers. Yeah, not getting overloaded. When you're sitting in the doctor's rooms getting, bad news or a bad diagnosis, it's really hard to take it in. You're pretty much in shock. So it's quite often it's a day or 2 or even a week or longer later that it really sinks in. But sometimes you're on a roller coaster. You've got to go from one appointment to another appointment to another, that you just go along with it. And it's just like a gradual, it's slowly sinking in. And I was in denial for quite a long time. So even though my husband and everyone else knew exactly what was going on, I was, oh yeah, I'm fine. I'll just do this treatment and I'll be fine. Yeah. As much as I really love and trust my oncologist, sometimes I feel that she rushes me along like I'm an easy patient, because I don't give her a lot of grief. I don't have to keep changing treatments or have lots of issues. And quite often she'll just throw a prescription at me if I've got an issue, rather than trying to look at the underlying cause. So I found that just a little disappointing. But when I've seen other specialists like the neurosurgeon or the radiation oncologist, they've been absolutely brilliant. I couldn't have asked for better people to be part of my team. I think what disappointed me when I was originally diagnosed with stage 4 was that my oncologist didn't even suggest I see a psychologist. Something as significant as this. I don't know whether she thought that, because she'd seen me go through breast cancer before and how strong I was, that I didn't need it this time. So I think there are a few things that haven't been offered that I felt I should have been offered. Well, fortunately, I've had lots of leave up my sleeve. So whenever I need time off, either the chemo or treatments, I've covered it myself. And in the event that runs out, I do have income protection. But if I do get really sick and have to give up my job, there is the option that my oncologist can say I've got less than 2 years to live, and then I can claim my my life insurance and superannuation. We don't want to go there. Fortunately, all my treatments are covered by my private health insurance. I have treatment at a private clinic. All my blood tests are covered, my CT scans, brain MRI, the echocardiograms, all those tests are bulk billed. So the only out-of-pocket costs I've had have been the neurosurgeon and the anaesthetist when I had my brain surgery. And they were really brilliant. They had a maximum $500 out of pocket, which was unbelievable in a private hospital. So just seeing my oncologist and all the allied health professionals, they cost money. So like the podiatry and massage and physios and all my medications. So they're all out of pocket. I'm a pretty strong and determined person, and I got through that first lot of breast cancer and I was fine. I got on with life. I was a survivor. And it took me a couple of years into my stage 4 diagnosis before I really needed to talk to someone. Because when you're thinking about cancer every day and you're thinking about dying every day, it really messes with you. So I saw my GP and she got me a care plan, and that's probably one of the best things that I've done. I got a lot of coping techniques and that really helped. I also take a mild antidepressant, which helps with my nerve pain. I think that probably helps me just have a little bit calmer demeanour. Yeah. Most definitely, yes. With my husband, due to the early menopause issues, that's caused a few discussions in our relationship, but he's very supportive and willing to work with me to try and resolve issues that we have. The fact that it's now stage 4 and we don't know how long it is until it comes back again. There's been quite a bit of, I guess, pre-grieving with my husband and my son and the rest of my family. I know that my mum is very worried about me. But my friends have been very supportive. The ones that were there earlier are still there. The ones that are important to me are still there. So. For me at the moment, because I've had so many treatments, my veins are starting to fail and I don't want to have a port inserted. So anything that doesn't involve a cannula would be fantastic. So if it was oral, I know that the Herceptin can now be given via an injection, but the pertuzumab is still via IV. So I think my treatment may change in the new year and it might just go down with the Herceptin, so that would save my veins. But anything that's got less side effects, it's got to be good. I think like a one-stop shop for all your ancillary services, where you can access your oncology, massage, or your exercise physiologist, acupuncture, podiatry, psychologists, either all in the one place, or you have a list of those that are available who are specifically trained to look after cancer patients in your area. Having that available would be really, really good. Also a support group for people with, I guess, metastatic HER2 positive. I do have a Facebook group where I connect with a lot of ladies who are similar to me with HER2 positive breast cancer. And that's really good that we can compare, talk to each other and share notes. That's really helpful. Firstly, talk to someone like a psychologist. That would be the first thing. I really wish I'd done that. Also having access to a metastatic breast care nurse. I didn't realise that being in a private clinic, I'm not eligible for that. I could have, when I was having my radiation on my brain, I could have accessed her there, but I didn't know that. I've got to be back at a public hospital to get that. So maybe that might have changed whether I had my treatment in the clinic or the public system, I don't know. Also, I just found out recently, statistically wise, HER2 patients that have metastatic breast cancer have double the lifespan of people who have other types of metastatic breast cancer. And I didn't know that until just recently. So I went from 50% chance of living to past 5 years, but I've done that anyway, so I'm beating the odds. For about 15 to 20% of all breast cancer diagnoses are HER2 positive, and they're more common in younger premenopausal women, such as I was when I was originally diagnosed. It's aggressive type of cancer, and we need to pick it up in the earliest stages. So if we could get research into something like a blood test that could pick up your risk of getting HER2 cancer, that would be amazing. That could be a game changer. I know there are lots of drugs out there that can treat HER2 positive cancer, and that's great. And there are lots of new trials coming along. But for me, they're aimed at early breast cancer, and I'm now stage 4. I want things coming along for my world. Living every day with a chronic illness, and I shouldn't have to change my life. If we had an organisation in Australia that just did metastatic cancer research and support like they do in America, that would be a game changer. I know I have HER2 breast cancer, and there are a lot of people in my same shoes as me who are metastatic stage 4. But it's just come out recently that there are no statistics kept honest. So I want the health minister to know whether we count